anxiety, there is nothing to be worried about. Everything is under control. And that is why I stated very clearly in my statement that there is no restriction to travel, to trade, to tourism. And there will be no lockdowns. Because this is a preventable disease, it is manageable. And we can all manage it together. The international health regulations that was amended recently, I think this was May this year, clearly states that even in the event of outbreaks or pandemics, there should be no restriction to travels. So nobody is going to restrict the truck drivers. We need them to move and carry goods to the various neighboring countries. We only want to provide information to them to protect themselves. And that is what is important, because they need to know if I wash my hands, if I use sanitizers, if I don't go with people that I don't know, somebody may be in the prodromal syndrome with mouth sores and so on, I will not get mpox. We need to disseminate the information widely, and that is what we are doing, so that we can prevent, and prevent. Now, when all of you spread the right information about the modes of transmission and how to prevent, then mpox will not spread. And that is what we need to know. Now, it was absolutely right for the African CDC to deliver vaccines to DRC. That is the epicenter. And DRC has the largest numbers of infected people. So if you prevent at source, then you will prevent the spread. Many of our countries, for example, in Uganda, so far we have only reported 10 cases. You can't compare Uganda with the DRC. And these 10 cases, some have already improved, over 4 cases. The people taking care of them are doing a good job. Now, the vaccine is for prevention. And Uganda has already been offered 2,000 doses. It has been offered, but the vaccine has to undergo systems in Uganda, because the World Health Organization is still looking at the documents, preparing whether to consider it for emergency use listing. Remember, even when WHO does that, in country, we have to do a similar thing. Consider it, look at literature, whatever is available, perhaps even do some tests. So NDA has to do its work. The National Immunization Technical Advisory Group also have to do their work. What if they say, no, in Uganda we don't need? Then we have to listen to them as well. So African CDC will not bring the vaccine until the systems in Uganda have concluded and are ready to receive the vaccines. And I think that answers his question as well, because I clearly stated that as the various organs in the country are doing their work, we are also drawing up our plan on whom to consider for the vaccine. And the consideration will be for those that are most at risk. But it will follow the districts, mainly the districts that border the DRC, because they will be most at risk. So when you ask that when do we expect the vaccine will come. I can't give you a date. Let the organs, the different institutions finish their work, and the vaccines will come. Yes, children are going back to school. Are we worried? No. And we are not going to close schools. That is not necessary. Children have to go back and study. What is necessary, what is critical, what is vital is that we all understand how to prevent. And that information will be given to all the schools to prevent. I mean, avoiding contact. Now, if there is no infectious person going into the schools, then where will the schools get it from? All we need to do is to be vigilant, pick out the cases, and leave the schools to continue. We already lost 2 years, remember, with COVID. That is not going to happen again. All we require from you is to be vigilant. And please do not scare anybody about monkeypox. Do not scare anybody. The Ministry of Health is in control. The treatment for monkeypox is majorly supportive. Majorly supportive, and a large number improve. The mortality rate is very minimal. I already gave you the figures. For the cases where it goes to a severe line, that is majorly in children less than 5 years, Dr. Chobe will later on talk about how we are managing them. Are the vaccines donations or taxpayers' money? First of all, we need to understand that vaccines are in very short supply. Very short supply. And later on, WHO and CDC will talk about it. Very short supply. So what we are getting right now are donations. We have not yet reached that point when government should consider buying, because we don't have many cases. But we have those that are at risk. So if we prevent in those who are at risk, then you on this side are protected. The districts that are at risk, I said districts that are bordering the DRC. Majorly the eastern border. Do we have concerns about stigma and discrimination? Madam, in Uganda, we have handled many outbreaks, very many, more than any other country. Our population are very supportive. They listen and they know what to do. When we handled COVID-19, nobody ran away from the patients. They supported them. Similarly, right now, what they are doing is to support those that they think have monkeypox, direct them to the health facilities where they can be treated. Of course, when you see a person with monkeypox, with all the rash and so on, there may be fear in the heart. I don't deny that. Everybody will be scared when they see that fear. But we have not yet, experienced stigma and discrimination among the population. We have not. But even that, we have very few cases. So I cannot yet begin talking about stigma and discrimination. The few that we have received have been referred by the population. The vaccines that are donated were MVA. CDC director will talk about it. The centers or private clinics that may not refer cases. I think this will depend on how we sensitize them. Monkeypox is not like COVID-19. So the more information they have, the more willing they will be to refer the cases. But remember, we are not planning to isolate everybody because the treatment is majorly supportive. So we have also structured our treatment depending on severity of disease. We will only be isolating those that are having severe disease. Some of the cases can be managed at home. You isolate at home, rehydrate at home, and you're good to go. Monkeypox is self-limiting. So eventually it wears off. So we should not worry about these clinics. In any case, some of the cases that were referred to us came from the private clinics. So they will come. What are we doing in refugee camps? We are sensitizing the population in the refugee camps, giving them all the information they need to know on how to prevent themselves from getting this disease. And that is what the entire population needs to know. prevention, prevention, and prevention, including the pregnant mothers. They need to know how to prevent. I think those were the questions. The others will be answered by WHO, CDC. Henry Chobe, you start with your question. You have a question.